Welcome to this Chemscape presentation on Hantavirus. In this video, we will learn what Hantavirus is and how to prevent exposure. Hantavirus is a group of viruses that are carried by rodents. In North America, deer mice are the main carrier of Hantavirus. Deer mice are small rodents with brown-gray fur and white fur on the underside of their body. Hantavirus made international headlines in May 2026 with news of a cruise ship outbreak in the Atlantic Ocean. 7 hantavirus cases of the Andes virus strain were confirmed, and 3 deaths on board demonstrated the severity of infection. An international health response by the World Health Organization to quarantine passengers and investigate has occurred. This shows the rapid transmission potential of this virus in close quarters. Hantavirus can cause serious illness or even death. It is estimated that 38% of those who contract hantavirus do not survive. Virus transmission occurs through the urine, droppings, or saliva shed from an infected rodent. Because it is impossible to tell if a rodent is infected with hantavirus, it is best to take precautions as if all rodents are potentially infected. It is extremely rare for human-to-human transmission to occur. The risk of infection varies by workplace, task, and situation. Any task you have contact with rodents or rodent droppings, urine, or saliva involves a risk of exposure to hantavirus. The risk of exposure will be higher in these workplaces: agricultural operations, cleaning, restoration, and waste removal, work camps and construction sites, garbage and recycling services, and plumbing and electrical work in older buildings or confined spaces. Hantavirus spreads to people from breathing contaminated dust particles from rodent urine, droppings, and saliva. People can also contract the virus from contaminated material by touching their eyes, nose, mouth, or broken skin. Direct bites from infected rodent during handling can transmit the virus, although this is an uncommon route of exposure. Person-to-person transmission is very rare and limited to the Andes virus strain only. Hantavirus has an incubation period of 1 to 8 weeks. Early flu-like symptoms develop that include muscle aches, dizziness, tiredness, fever and chills, coughing, headaches, and stomach pain. More severe symptoms include nausea and vomiting, shortness of breath, and severe difficulty breathing. If you have experienced rodent exposure recently and are having difficulty breathing or flu-like symptoms, seek medical assistance immediately. Respiratory failure resulting in death can occur within a few days of the onset of symptoms. Following the hierarchy of controls, we can now determine how to reduce risk of exposure to hantavirus. All or just some of these approaches may be required to prevent or reduce worker exposure to hantavirus. Ongoing pest management is important to keep areas rodent-free and eliminate the risk as much as possible. Pest control can include ongoing inspections to check for rodent infestations including droppings, nests, tracks on dusty surfaces. Cleaning and sanitization, which includes eliminating food sources and nesting sites. Rodent-proofing entrances to buildings. Using traps or rodenticide to reduce the rodent population. If you suspect rodent droppings at a worksite, increase the ventilation by opening doors and windows for 30 minutes before entering a building and starting work. Extensive cleanup of rodent droppings may require increased exhaust ventilation and containment of contaminated work areas. HEPA or high MERV filters are considered best practice for removing particulates from the air. Following certain work practices can help reduce your exposure. This includes report evidence of rodent activity, procedures for cleaning and removal of rodent feces and nests, decontamination procedures after handling contaminated materials, using a 10% bleach solution to spray on contaminated waste and wait before handling. Follow procedures for proper disposal of waste and PPE. Eat, drink, or smoke away from the work area. Contaminated clothing should be identified, handled, and laundered separately. Good work practices include washing hands, removing PPE safely, and changing gloves after handling potentially infected materials. The amount of PPE to be worn for protection increases as the amount of rodent droppings increases, and contamination may become airborne. The corresponding respiratory protection increases also with exposure risk. You should report any rodent activity or exposures. A worker who is experiencing symptoms after a potential hantavirus exposure should seek medical attention. Key takeaways. Hantavirus is a serious occupational hazard with 38% fatality rate. A recent 2026 outbreak shows transmission can be rapid and severe. Prevention focuses on avoiding airborne contaminated particles. Proper PPE and wet cleaning methods are essential. Seek immediate medical attention for breathing difficulties, and report rodent activity to supervisors immediately. This concludes the presentation on hantavirus. Your work has an influence on your health. Protect your health in the workplace and your personal life.